Rider needs and developmental task of newborn, infant, toddler, preschooler, schooler, and adolescent. Growth and development are continuous processes that occur from birth to adolescence. Each stage of life has specific need and developmental task. Developmental tasks that help the child to achieve physical, emotional, social, and intellectual maturity. Newborn. Newborn needs also warmth and protection from infection. Warmth and protection from infection, exclusive breastfeeding, proper sleep and rest, hygiene and cot care, safe environment and gentle handling, parental love, comfort and touch. Developmental task, establish physiological stability, breathing, feeding, elimination. Develop bonding and trust with mother. Develop bonding and trust with mother. Adjust to external environment. Adjust to external environment. Newborn need also warmth and protection from infection, exclusive breastfeeding, proper sleep and rest, hygiene, cot care, safe environment and gentle handling, parental love, comfort and touch. Developmental task, establish physiological stability, developing bonding and trust with mother, adjust to external environment like temperature, light, sound. ইনফ্যান্ট ইনফ্যান্টের নিড হচ্ছে ছটা করে নিড আছে। প্রপার নিউট্রিশন মানে হচ্ছে এক্সক্লুসিভ ব্রেস্ট ফিডিং আপ টু 6 months, দেন উইনিং ফুড, immunization and regular health checkup, prevention of infection and clean environment, stimulation through play and interaction, love, affection, security. Developmental tasks, develop trust versus mistrust. Eric Erikson theory. Begin motor activity control মানে হচ্ছে head holding, sitting, walking, crawling. Develop communication, recognition of familiar faces and separation anxiety. Toddler need হচ্ছে balanced diet for growth, toilet training, hygiene habit, freedom to exposure and move, consistent discipline and affection. Developmental task, develop autonomy versus shame and doubt, learn to walk, run and climb, self-feeding and self-dressing, start using simple sentences. Control of elimination. প্রিস্কুলারের ক্ষেত্রে হচ্ছে ব্যালেন্স নিউট্রিশন অ্যান্ড অ্যাডিকুয়েট স্লিপ, প্লে ক্রিয়েটিভিটি অ্যান্ড ইমাজিনেশন, safety and hygiene education, love, acceptance and encouragement. Developmental tasks, develop initiative versus guilt, improve gross motor and fine motor skills, learn cooperation and sharing, begin understanding rules and moral behavior, develop self-confidence and curiosity about all things. School age need হচ্ছে adequate nutrition for steady growth, learning opportunities, physical activity, recreation, peer interaction and social development, emotional support and parental involvement. Developmental task হচ্ছে develop industry versus in interiority, develop reading, writing, math skill, learn teamwork and responsibility, develop self-control and moral reasoning. Adolescent need হচ্ছে balanced diet and personal hygiene, guidance in puberty and reproductive health, socialization and decision making, emotional support and understanding from parents, education and career guidance. Developmental tasks, develop identity versus role confusion, establish body image and sexual maturity, stable friendship relationship, develop value, goal, and independence, prepare for adulthood and future career. Hospitalization is the process of admitting a patient into a hospital for medical diagnosis, treatment, or recovery under the supervision of healthcare professionals. Hospitalization is the process of admitting a patient into a hospital for medical diagnosis, treatment, or recovery under the supervision of healthcare professional. Purpose হচ্ছে to provide intensive medical or surgical care, to perform necessary investigation or operation, manage emergency or complication, to ensure rest, nutrition, and nursing care. Types of hospitalization. Hospitalization में two type, emergency or elective. Stressor for hospitalization in any physical, emotional, psychological factor that causes stress or discomfort to a patient during their hospital stay. A stressor for hospitalization is any physical, emotional, psychological factor that causes stress or discomfort to a patient during their hospital stay. It means the things or situation in the hospital that makes the patient feel tense, anxious, or uncomfortable. Example of stressor during hospitalization হচ্ছে physical, psychological, social, developmental, and environmental. Physical stressor হচ্ছে pain from illness, surgery, restricted movement, immobility, loss of sleep or fatigue, excess light, sound, noise. Physiological discomfort during medical procedure or injection. আর হচ্ছে সাইকোলজিক্যাল স্ট্রেসের দিস এফেক্ট মাইন্ড অ্যান্ড ইমোশন ইনক্লুড করে হচ্ছে ফিয়ার অফ ডেথ অর ডায়াগনোসিস, এনজাইটি অ্যাবাউট ট্রিটমেন্ট অ্যান্ড রিকভারি, লস অফ কন্ট্রোল। সোশ্যাল স্ট্রেসের হচ্ছে ল্যাক অফ প্রাইভেসি, ইনঅ্যাবিলিটি টু কমিউনিকেট, loss of contact with friends, sibling and family, limited play and social interaction, parental separation and concern. Developmental stressor, loss of independence, regression in behavior, interruption of normal growth and developmental activity. Environmental stressor হচ্ছে disrupted relationship with family and friends, concern for missing school, play deprivation, unfamiliar hospital environment. তাহলে হচ্ছে এক্সাম্পল অফ স্ট্রেসর ডিউরিং হসপিটালাইজেশন: ফিজিক্যাল, ফিজিওলজিক্যাল, সাইকোলজিক্যাল, সোশ্যাল, ডেভেলপমেন্টাল, এনভায়রনমেন্টাল। ছটা আছে। ফিজিক্যাল স্ট্রেসর হচ্ছে পেন ফ্রম ইলনেস অর সার্জারি, রেস্ট্রিক্টেড মুভমেন্ট, ইমমোবিলিটি, লস অফ স্লিপ অর ফ্যাটিক, এক্সেস লাইট, নয়েজ, সাউন্ড। Physiological discomfort during any medical procedure and during injection. Psychological stressor: fear of death, diagnosis, anxiety about treatment or recovery, loss of control. Social stressor: lack of privacy, inability to communicate, loss of contact with friends, siblings and family, limited play and social interaction, parental separation and concern. Developmental stressor: loss of independence, regression in behavior, interruption of normal growth and developmental activity. Environmental stressor: disrupted relation with family and friends, concern for missing school, play deprivation and unfamiliar hospital environment. Effect of hospitalization in child. Illness and hospitalization causes stress and negative impact among children. Each child perceives illness and hospitalization uniquely. ইনফ্যান্টদের ক্ষেত্রে হচ্ছে সেপারেশন এনজাইটি হবে, লস অফ কন্ট্রোল হবে। দিস ইজ অলসো নোন অ্যাজ Analytic depression. The degree of anxiety depends upon the degree of deprivation. In case of partial deprivation, infant may exhibit acute anxiety along with desire for love and affection. But in complete or total deprivation, infant may develop inability to form a trusting relationship with parents further in later life. Loss of control. Infants develop reduced sense of control due to preference given to the hospital routine, their treatment need and neglect to their emotional need. Expressive effect of infant include হচ্ছে crying or shouting. Toddler ক্ষেত্রে হচ্ছে separation anxiety হবে, loss of control হবে, loss of body injury or pain. প্রি-স্কুলের ক্ষেত্রে সেপারেশন এনজাইটি হবে, লস অফ কন্ট্রোল হবে, দে এক্সপ্রেস বাই ক্রাইং কোয়াইটলি, রিফিউজিং ফুড এটসেট্রা। লস অফ বডি ইনজুরি, পেন, হেয়ার লস রেজাল্টিং ইম্প্যাক্ট অন সেলফ ইমেজ অ্যান্ড সেলফ এস্টিম। স্কুলের চিলড্রেনের ক্ষেত্রে অ্যাডোলেসেন্টের এক্সপ্রেসিভ এফেক্ট, anxiety, anger and stress. Effect of hospitalization on family. When a child is hospitalized, it affects not only the child but also the entire family emotionally, socially, and financially. The major affect include emotional affect, anxiety and fear. Parents often faces anxious about the child health treatment. They blame themselves. Parents may be overburdened, may sometimes get confused. Stress and depression, continuous hospital visit, lack of rest, uncertainty can cause mental exhaustion. Sibling neglect or jealousy. Other children at home may be neglected or jealous due to parents' attention being focused on sick child. Social effect হচ্ছে disruption of daily routine, juggling between responsibility of home, hospital and work, change in work commitment and income, reduce parental attention on other children. Social isolation, parents may withdraw from social life to stay with the hospitalized child. Financial effect হচ্ছে increase expense, economic burden, increase expense, medical bill, travel costs, loss of income, it taken leave from work. Economic burden, long-term illness or hospitalization can strain family finances. Physical effect হচ্ছে দুটো, health problem or fatigue. Prolonged stress may lead to headache, insomnia or other stress-related condition. Fatigue, parents staying in the hospital may have disturbed sleep and poor nutrition. The information overload. For most parents, understanding the vast, complex and highly specialized information about child illness can be very difficult and stressful. Grief and loss. Sadness, guilt, denial and anger are commonly seen when a sense of loss occurs. Desired effect of hospitalization, recovery, early discharge, prevention of further disability, gaining more experience than other children, increase patience, increase knowledge, become confident, increase industries. আরওপি হচ্ছে রেটিনোপ্যাথি অফ প্রি ম্যাচিওর বেবি। Retinopathy of prematurity is a disease of the eyes that affect premature or preterm newborn, especially those with very low birth weight. It occurs due to abnormal blood vessel growth in retina. Occurs due to abnormal blood vessel growth in retina. Retinopathy of prematurity is a disease of the eyes that affect premature or preterm newborn, especially those with very low birth weight. It occurs due to abnormal blood vessels growth in the retina. Causes: ROP occurs due to abnormal development of retinal blood vessel in premature babies. Main risk factor may include premature birth, very low birth weight, excessive oxygen therapy, mechanical ventilation, sepsis or infection, blood transfusion, poor weight gain. Classification of ROP. ROP can be classified based on severity and location of disease. বেসড অন সিভিয়ারিটি আর হচ্ছে লোকেশন অফ ডিজিজ। যদি সিভিয়ারিটির উপর বেসড অন করা যায় তাহলে হচ্ছে 5টা স্টেজ। স্টেজ 1 হচ্ছে মাইল্ড অ্যাবনর্মাল ব্লাড ভেসেলে থিন হোয়াইট লাইন অফ ডিমার্কেশন ইজ ফাউন্ড between vascular and avascular region of retina. স্টেজ 1 ইনভলভ করে হচ্ছে vascular and avascular region of retina. Stage 2 moderate abnormal vessel. Ridge is formed in addition of depth and width. Stage 3 presence of extra retinal fibrovascular proliferation is found. Risk for detachment. Stage 4 partial retinal detachment begins at the ridge. Stage 5 complete retinal detachment is found, lead to blindness. Based on location হচ্ছে 3 zone, zone 1, zone 2 আর zone 3. Zone 1 circle involve optic disc and molecule as center. Circle involve করো optic disc আর হচ্ছে maculae as center, whose radius is twice from the distance of center of optic disc to center of maculae. Zone 2 circle whose radius is the distance from the center of optic disc to the nasal margin of retina. Zone 3 circle involve remaining temporal crescent of retina to temporal ora serrata on nasal side. এবার হচ্ছে আরওপি প্লাস ডিজিজ। প্লাস ডিজিজ ইজ দ্য সিভিয়ার ফর্ম অফ আরওপি। Plus disease is a severe form of ROP characterized by venous dilation, arteriolar tortuosity of posterior retinal blood vessel and poor pupillary dilation. Plus disease ছাড়া আছে হচ্ছে APROP, aggressive posterior ROP. Plus disease are aggressive posterior ROP. It is the rapidly progressive severe form of ROP in very immature infant with prominent plus disease. Sign and symptom হচ্ছে usually no visible early symptom, baby needs screening. Late sign হচ্ছে white pupil, leukocoria, eye shaking মানে হচ্ছে nystagmus. Crossed eye থাকবে মানে হচ্ছে strabismus. Poor visual response, usually no visible early symptom, baby needs screening. Late sign হচ্ছে white pupil, eye shaking, crossed eye আর visual response. Screening. ROP screening should be performed in this condition with infant. All babies born before 35 week gestational age but with less than 2 kg. Any preterm infant with risk factor like cardiorespiratory instability, prolonged oxygen therapy or repeated apnea. Preparation before ROP screening. NPM for 2 hours থাকতে হবে. Pupil dilation of both eye every 15 minutes for 3 to 4 hours by instilling 0.5 থেকে 1% tropicamide. ট্রিটমেন্ট হচ্ছে 3টা আছে। লেজার থেরাপি মোস্ট কমন, anti-VEG drug injection, anti-VEGF drug injection, আর একটা আছে ভেট্রিওরেটিনাল Vitreoretinal surgery. Prevention of ROP, prevent prematurity, careful oxygen monitoring in SNCU, good nutrition, regular eye screening for premature infant. রেগুলার আই স্ক্রিনিং করাতে হবে, গুড নিউট্রিশন দিতে হবে, কেয়ারফুল অক্সিজেন মনিটরিং ইন এসএনসিউ, আর হচ্ছে প্রিভেন্ট প্রিম্যাচুরিটি। নার্সিং রোল হচ্ছে মনিটর অক্সিজেন থেরাপি, অ্যাসিস্ট ইন আই এক্সামিনেশন, প্রমোট প্রপার ফিডিং ফ্রম ওয়েট গেইন। Promote proper feeding for weight gain. Educate parents about ROP screening schedule. Early referral to eye specialist. KMC. KMC is a special method of caring for low birth weight and premature babies by providing continuous skin-to-skin contact with the mother and to promote their health and well-being by effective thermal control, breastfeeding, and bonding. Key component of KMC. There are three components of KMC including skin-to-skin contact, exclusive breastfeeding, early discharge, and continuous follow-up. Benefit of KMC. KMC help in thermal control metabolism. KMC হচ্ছে থার্মাল কন্ট্রোল আর মেটাবলিজমে হেল্প করে, ইমপ্রুভ ব্রিদিং অ্যান্ড হার্ট রেট, হেল্প করে হচ্ছে ওয়েট গেনে, প্রোটেক্ট করে এগেনস্ট নজোকোনিয়াল ইনফেকশন আর রিডিউস ইনসিডেন্স অফ সিভিয়ার ইলনেস, রিডিউস হসপিটাল স্টেইং অ্যান্ড কস্ট, better breastfeeding success, আর promote bonding and emotional development with mother. Prerequisite of KMC হচ্ছে support to the mother আর post discharge follow. Prerequisite: mother needs support in hospital and home from caregiver and family members. Counseling and supervision should be provided to the mother. Post discharge follow up. KMC should be continued at home after discharge from hospital. Eligibility criteria হচ্ছে for baby. In a stable newborn, KMC can be initiated soon after birth. All stable low birth weight baby, preterm baby, infant with birth weight less than 1200 gram with serious prematurity may take a few days to weeks to allow initiation of KMC. For mother, all mother can be provided KMC irrespective of age, parity, education, culture, religion. All mothers can be provided KMC. Mother should be free of serious illness and able to take adequate diet and supplement. Mother must be willing to provide KMC. Mother should maintain good hygiene daily, but clean clothes, start and clean fingernails. Preparation for KMC হচ্ছে কাউন্সিলিং, মাদার্স ক্লোদিং, বেবিস ক্লোদিং দেখতে হবে, ফ্রন্ট ওপেন হতে হবে, কমফোর্টেবল হতে হবে। KMC procedure. Procedure when to discontinue. Based on birth weight and gestational age, a three-tier system of neonatal care is proposed for developing countries. Level 1 care: about 80 to 90% of neonates require minimal care, which can be provided by their mother with support from family members and under supervision of basic health professionals. The neonate weighing have above 2 kg are having gestational age of 37 weeks or more belonging to this category. This care can be given at home, sub-center and primary health center. Essential perinatal care should be provided at basic care at birth, provision of warmth, maintenance of asepsis and promotion of breastfeeding. Level 2. Neonate weighing between 1500 থেকে 2000 are having gestational age of 32 to 36 weeks need specialized neonatal care supervised by trained nursing staff and pediatrician. This intermediate neonatal care should be provided the equipped district hospital, teaching institution and nursing home. There should be arrangement of resuscitation procedure, maintenance of thermo-neutral environment, intravenous infusion, garbage feeding, phototherapy, exchange blood transfusion. Only 10 to 15% of all neonates require this care. It should be available at all hospitals where 1000 to 1500 delivery take place per year. Level 3. Neonate weighing less than 1500 gram are born before 32 weeks gestation require intensive neonatal care. Only 3 to 5% of all newborn baby need this care by skilled nurse and neonatologists specially trained in neonatal intensive care. Apex institution or regional perinatal center equipped with centralized oxygen and suction facility, incubator, ventilator, monitor and infusion pump etc. best suited to provide intensive neonatal care. High-risk pregnancy which are associated with birth of high-risk neonate must be identified during pregnancy and referred to an appropriate center for skill management and better outcome. At birth, detection of high-risk neonates should be done at all levels of healthcare delivery system and appropriate referral is essential to different level of neonatal care for prevention and reduction of neonatal mortality and morbidity. Level of care in newborn. Newborn care divided into level depending on the baby's gestational age, birth weight and medical needs. Each level provides different type of monitoring, treatment and support. There are 4 level of care: level 1, 2, 3 or 4. Level 1 হচ্ছে include basic newborn care. Level 2 তে special newborn care. Level 3 হচ্ছে neonatal intensive care unit. Level 4 advanced neonatal intensive care unit. লেভেল 1 এ হচ্ছে বেসিক নিউবর্ন কেয়ার, লেভেল 2 তে স্পেশাল নিউবর্ন কেয়ার, লেভেল 3 তে নিওনাটাল ইন্টেন্সিভ কেয়ার ইউনিট মানে হচ্ছে এনআইসিইউ, আর লেভেল 4 এ হচ্ছে অ্যাডভান্স এনআইসিইউ. Purpose of level of care. The purpose of dividing newborn care into different levels is to provide appropriate care according to newborn condition, reduce newborn morbidity and mortality, identify and manage high-risk newborn early, ensure specialized care when needed, support to mother-baby bonding and breastfeeding. লেভেল 1 এ হচ্ছে বেসিক নিউবর্ন কেয়ার. বেবিজ ম্যানেজ হচ্ছে টার্ম বেবি, হেলদি নিউবর্ন উইথ নো কমপ্লিকেশন, বেবিজ নিড ইমিডিয়েট কেয়ার আফটার বার্থ. Facilities and intervention. Early initiation of breastfeeding, thermal protection, immunization, provide cord care and hygiene, monitoring vital signs, screening test, routine checkup and follow-up. Level 2 হচ্ছে স্পেশাল নিউবর্ন কেয়ার ইউনিট এসএনসিইউ. Care for Care for moderately sick newborn who need specialized care but not intensive ventilation. Preterm baby more than 32 weeks. Hmm. Baby weighing more than 1500 gram. Mild to moderate illness. Condition treated moderate respiratory distress, hyperbilirubinemia, jaundice, hypoglycemia, feeding difficulty, suspected sepsis. আর ফেসিলিটি দেওয়া হয়েছে ফটোথেরাপি, ওয়ার্মার, ইনকিউবেটর, অক্সিজেন থেরাপি, টিউব ফিডিং, আইভি ফ্লুইড, অ্যান্টিবায়োটিক, বেসিক মনিটরিং। লেভেল 3 নিওনাটাল ইন্টেন্সিভ কেয়ার ইউনিট, কেয়ার ফর ক্রিটিক্যাল হাই রিস্কি এক্সট্রিমলি প্রিম্যাচিওর বেবিস। Condition treated RDS, severe bath asphyxia, sepsis or septic shock, and apnea, seizure, congenital anomalies needing stabilization. ফেসিলিটিস হচ্ছে মেকানিক্যাল ভেন্টিলেশন, সিপ্যাপ, লং টার্ম সাপোর্ট, টিপিএন টোটাল প্যারেন্টাল নিউট্রিশন, ইনফিউশন পাম্প, ব্লাড গ্যাস মনিটরিং, সার্ফেক্টেন্ট থেরাপি, এক্সেস ট্রান্সফিউশন ফেসিলিটি। Level 4 Advanced NICU, highest level care for complex surgical and life support need. Condition treated congenital heart disease, intestinal obstruction, severe respiratory failure, major neurological condition, extreme prematurity. Facility হচ্ছে pediatric surgery করা হয়, advanced ventilator and ECMO দেওয়া হয়, cardiac care technology, neonatal anesthesia support, advanced life support.